Hey, it's Dr. Watt from Pinecrest Chiropractic. Let's talk through 3 of the most common causes of foot pain and how we can tell the difference between the two and why we might get them mixed up. The first one is going to be one that you've probably heard of. It's called plantar fasciitis. Plantar fasciitis is just an inflammation of the plantar fascia. The plantar fascia just runs along the bottom of the foot and can get inflamed. Now, this is usually going to happen closer to the heel. In fact, it's going to be on the heel, a little bit on the inside of the heel, not directly in the center. Usually, there's always an asterisk with it, right? This pain is going to be worse first thing in the morning and usually feels like a really sharp pain, especially when you step down first thing getting out of bed. Sharp stabbing pain, sometimes radiating out through the bottom of the foot, but primarily right around the heel. The second type is going to be a heel fat pad syndrome. There's fat on the bottom of your foot that should stay underneath the calcaneus. This is if we're looking at the back of the foot, this person's walking away from us. And that fat pad there is going to start to smush and start to disperse out to the side. This is going to be more of a dull ache pain. This one's going to hurt more consistently throughout the day, hurts drastically when we're on our bare feet, but it's not going to be just first thing in the morning. It's not going to be that sharp pain like the first one. So they're a little bit different. This one's also going to be more of the center of the calcaneus or the heel versus just to the inside. Now, those are the 2 traditional differences. These 2 get mixed up a lot because they're so hard to tell apart from each other. But if you can look at those couple of things that we've already talked about, just the location on the heel, what it feels like and when it's bothering you, you should be able to differentiate between the 2 of them. Now, the third one is one that's not talked about very often. This is going to be a posterior tibial tendonitis. Now, your posterior tibialis is a muscle that starts on the back of your shin. So it's really hard to orient ourselves on this picture. This is the back of the knee. This is the shin bone or the tibia, and it's running along the inside of that, down onto the side of the foot, into the bottom of the foot. If you were to find this on yourself, palpate the front of your shin, and then work towards the middle side there. And as soon as you step off the bone, you're gonna feel it start to squish in. That's where you're gonna feel that posterior tibial muscle. When you have this type of tendonitis, this muscle is often going to be very tight, and even just that little bit of palpation on yourself is probably going to hurt. On top of that, when it's a true tendonitis, the pain is going to be more down around the inside. So this big bone that you've got on the inside of your heel there, your malleolus, you're going to have tendon pain right behind that and then down onto the bottom of the foot. Now, this is different than a plantar fasciitis because that's going to usually originate more towards the heel and then occasionally spread to the bottom of the rest of the foot. This is going to be just all through the bottom of the foot. It's going to be a little bit more medial into the arch of the foot. And in fact, when we have a true tendonitis and it's a chronic issue, we'll often see more of a flat foot within this. Can't have flat feet as well with plantar fasciitis, but this is going to be more of it looks like it caused that flat foot. So all 3 of these can cause very severe pain with walking, and in different part of the foot, making just your day-to-day living significantly harder than it needs to be. I know it can be confusing to tell the 3 apart, but if you look at these things step by step like we did today, you should be able to tell the difference and then be able to treat accordingly. If you've got more specific questions about which one yours may be, come on in, let's chat about it.